Hi, thank you for watching Digging to China. I'm Dongsheng. If you have not done so already, you can pause and subscribe to my channel. Thanks in advance. Last Friday, Wall Street Journal reported that many patients have died in recent days at a large Shanghai elderly care hospital, according to people familiar with the situation. This new wave of infections is hitting Shanghai harder than authorities have publicly disclosed. Shanghai's government hasn't reported any COVID-related deaths or outbreaks in its hundreds of elderly care centers since cases began climbing in the city in March. Elder care facilities have been the starting point for numerous deadly outbreaks, including New York at the beginning of the pandemic, when COVID infections in nursing homes led to nearly 4,000 deaths. Outbreaks in nursing homes in Hong Kong this year have led to record death rates as well. Shanghai Donghai is the biggest elderly care center by capacity with 1,800 beds. It is run by a state-owned food conglomerate. Six replacement orderlies in Donghai told the Wall Street Journal that they had witnessed or heard of the recent removal of several bodies from the facility, where they said at least 100 patients had tested positive for COVID-19. These orderlies were brought in after previous caretakers were sent away to quarantine. Zhang Aizhen is an orderly who has worked in the hospital for more than a decade. She said she tested positive and then was put on a bus on the night of March 19th with dozens of staff, including nurses and doctors. She said she spent a week in a quarantine hotel before being moved to a makeshift quarantine center in a stadium last weekend. Orderlies, nurses, and doctors, we are all infected, she said. Last week, roughly 4,000 replacement orderlies have been hired by the hospital to replace caretakers who had been quarantined. Many of the replacement workers weren't told of conditions in the hospital before being hired and were shocked to be tasked with caring for so many COVID-positive patients, the people said. Zhang Ling is a 52-year-old woman and was one of the 4,000 orderlies hired since last week at the Donghai Elderly Care Hospital to support overstretched medical workers. Zhang Ling was a pseudonym she used, fearing retribution from her employer. She told Chinese online news site Six Tones that on her first day at work last week, she was expecting to don a hazmat suit as a precaution, but was not prepared to see that the nursing home was experiencing a COVID-19 outbreak among residents. Zhang is from the Ningxia-Hui Autonomous Region in China. She found the orderly job online. The position promised her a 500 yuan daily wage to take care of older residents. It is the equivalent to $80 a day. Zhang said 7 of the 8 older residents who lived together in the same ward where she worked with another colleagues had tested positive for the virus. They were marked by a yellow triangle-shaped tag. Most of them, she said, were unable to speak and in deteriorating health. They didn't get treatment and received little medication, living only on the food we fed them, said Zhang. Zhang told the Sixth Tone that she spends long hours with the residents in the ward, often eating near them. She said that the possibility of catching the virus and having to quarantine constantly haunts her. Over the past few days, Zhang said she complained to the hospital multiple times, asking to quit the job and get tested, but said her employer told them to stay put instead. She thought of leaving with other orderlies but were deterred because they would have to pay for hotel quarantine upon leaving the hospital. The lockdown disrupted other parts of Shanghai's healthcare system with deadly consequences. Shen Ruigen, a 77-year-old doctor, died alone in an intensive care unit on Monday, March 28th. He tested positive and was quarantined for 48 hours without the medicine he needed to treat his chronic kidney disease. Mr. Shen suffered a heart malfunction which may or may not have been related to his delayed kidney treatment. Public health experts have warned about danger Omicron poses to China's elderly population. With barely half of people over 80 having had 2 or more doses of vaccine, there are 4 million residents above age 65 in Shanghai, one of China's largest and oldest urban populations. More than half a dozen users on several of China's major social media platforms have also posted messages alleging unreported deaths at the hospital in recent days. The hospital doesn't publicize data on deaths, making it difficult to compare the recent rate of patient death with previous periods. Some relatives of patients said their loved ones were left unattended after infected caretakers were quarantined. Shanghai residents have crashed government and health commission hotlines with both COVID and general health inquiries. So hundreds of people are tuning to social media each hour as a way to secure urgent medical help. The lockdowns are also laying bare Shanghai's social inequalities. Affluent residential compounds have been able to organize private food deliveries, yet the city's migrant workers and homeless population struggle to find shelter or testing. Tech giant Tencent took down 2 videos earlier last week of a rare protest at a Shanghai housing compound. These 2 videos had been posted by users to their WeChat timelines and starting trending. Bloomberg News viewed and independently verified the footage. It showed in Shanghai's Minhang District's Jiangnan Xingyuan housing estate. Dozens of residents were behind the gates and chanting phrases such as, "We want to eat," "We want the right to know," and "We want freedom." People there have been confined to their homes since March 2nd, and the residents have undergone more than 10 rounds of mass virus testing, according to official notices from the compound's WeChat account. Tencent told the staffers the videos were taken down because they violated China's laws and policies. A third video of the compound's residents demonstrating, where the chanting is less clear and doesn't include terms like freedom, has been allowed to remain online. According to Bloomberg calculations, some 71 million people in China are either in lockdown or facing one imminently. Affected households often find themselves with inadequate access to food, as panic buying and a lack of delivery staff contribute to shortages. Lockdowns are likely costing the country at least $46 billion a month, or 3.1% of GDP in lost economic output. Lockdowns in the US are a thing of the past and will probably stay that way. Case numbers seem to be leveling off in the US. It's rare to see someone wearing a face mask in many places. By comparison, China has a zero COVID policy. As cases have been on the rise in more than 24 provinces, restrictions have gotten much tougher. In the past 2 years, China has kept the cases much lower overall than in the US, even during a spike. What's made things more difficult is how easy it is to catch COVID with Omicron. Omicron is 3 times as likely to spread as the Delta variant. None of the vaccines made to protect against the original strain works as well, especially in populations in China that haven't seen spikes over the past 2 years. Omicron BA.2 is especially contagious. Some epidemiologists have said BA.2's basic reproduction number may be as high as 12, meaning each sick person can infect an average of 12 others. That puts it on par with measles. The US population has built up immunity that China does not have. China has seen relatively few cases over the course of the pandemic. In other words, there is a much larger pool of people who might become infected in China than in the US. Sort of China's firewall has broken down with Omicron, and the country has a massive amount of people who are susceptible to the virus. Another problem for China may be the kind of vaccines it's used. China has mostly used the Chinese-made Sinovac and Sinopharm vaccines. Both companies said their vaccines were more than 78% effective against COVID-19, but the studies suggested otherwise. Late-stage trials of the Sinovac candidates in Brazil showed an efficacy rate of 50.38%, barely above the World Health Organization's threshold for approval. Other studies have suggested that immunity from 2 doses of these vaccines wane rapidly and that the protection may be limited, especially among older people. And against Omicron, all vaccines have been found to offer less protection. The cost of Shanghai's lockdown has raised some serious grumbles of discontent. China's zero-COVID policies still enjoy widespread support, but frustration is mounting at China's repetitive use of lockdowns to control the virus. Prominent health experts are calling for a clearer roadmap in China for eventually easing restrictions and living with an endemic COVID through higher vaccination rates among the elderly with more mRNA vaccines. Will Chinese leadership heed such advice? That is a $1 million question. No, that is a $1 billion question. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I'll see you again shortly.